A, B, C, D is 4 types of hypersensitivity reactions. Type 1 is allergy. First time you get stung by a bee, no big deal. Your immune system gets sensitized to bee venom and makes antibodies, which is fine if the antibodies are not IgE. If you're unlucky, the second time you get stung, you start overproducing IgE, which causes over-release of histamine and other mediators. This causes swelling and airway constriction, so you can't breathe unless you get a shot of adrenaline. You may remember adrenaline as fight or flight, so it relaxes airways, providing more oxygen to better run from tigers. Thus, adrenaline will also help to relax airways when you've got an allergic reaction. Type 2 is bad blood transfusion, cytotoxicity. If you have type B blood but get a type A transfusion, your body will use antibodies to kill cells with A's on them. Type 3 is clumps of the Arthus reaction. Back in 1900, Dr. Arthus injected rabbits with horse serum and magic clumps formed. Today we know these magic clumps are rabbit antibodies bound to foreign horse proteins. Sometimes humans get magic clumps when we only make enough antibody to bind to the antigen, but not enough antibody to get rid of the antigen. These magic clumps cause problems when they settle in joints or in the small blood vessels in the kidney. Type 4 is delayed and cell-mediated. You have bad bone marrow, so you get a donor. If the donor is not well matched to your body, his bone marrow graft will make T cells that don't recognize your host cells and start attacking them. It takes time for his T cells to mature and start attacking, which is why this is a delayed hypersensitivity. Also, it involves big killer T cells, not small antibody proteins, so it is cell-mediated. Pause and review. 4 types of hypersensitivity. Help Hippo.
The heart is divided into 4 chambers, 2 superior atria, singular atrium, and 2 inferior ventricles, each lined by a... I'm done studying. I'm sick of this class. I just want to take our exam and become a nurse. It's taking too long.
I know, it's so stressful. I can't stop stress eating right now. These Oreos just look so delicious.
Yeah. Probably just take a break. Are you okay?
My throat is getting itchy.
Are you allergic to anything?
I don't think so.
Alright. Do you have
what?
Maybe I should just call 911.
I'm fine. I mean, I have an EpiPen in my room, but I'm not allergic to anything.
Do you know where it is? Should I get it?
I think so.
Alright, well, I'm going to call 911 anyway and then get your EpiPen, okay?
Okay.
Hello? 911? It's done.
So what's going on here? This is an example of the type 1 reaction that we described earlier. The first time Marina encountered peanuts, the allergen invaded her body and plasma cells began producing a larger amount of IgE antibodies against the peanut allergy. The IgE antibodies then attach to Marina's mast cells, but no allergic reaction occurs during this first response. As we just saw, Marina was exposed to the peanut allergen again. At this time, though, the already created IgE antibodies combined with the peanut antigen, releasing histamine. The histamine causes the symptoms that Marina began experiencing. Smooth muscles contract, which causes her respiratory passages to constrict, which is why she was having the trouble breathing. The histamine also makes the blood vessels become leaky. This causes hives, itching, and other symptoms. Sometimes the reaction can become severe and life-threatening, resulting in anaphylactic shock. In anaphylactic shock, severe difficulty breathing, and hypotensive shock or very low blood pressure can result. Let's go back to Marina and see how her reaction plays out.
I got the EpiPen. Alright. Step 1, pull off blue safety release. Oh my god, you're getting hives!
Oh my god.
Okay. Step 2, swing and firmly push orange tip against outer thigh so it clicks, and hold for 10 seconds to stimulate drug delivery.
I can breathe.
So how did this EpiPen work? The EpiPen that Sarah gave to Marina contained the drug epinephrine, and this works to reduce the effects of histamine. Epinephrine increases blood pressure, dilates the respiratory passages, and also increases pulse. It is important to remember that epinephrine is not a cure for an allergic reaction, and 911 should still be called. Symptoms may also reappear 20 to 30 minutes after epinephrine is administered, so it's important that someone gets to a proper medical facility as soon as possible.
Oh, peanuts! That was a peanut butter sandwich. Are you not good with peanuts? What are you pointing at? What's going on? What's here? Oh, I got it! I got it! What do I do? What do I do? Pop back, pop. Okay, I'm on a slow reader. Okay, okay.